It is estimated that the prevalence of asthma in the United States is from 3 to 6% of the general population.
During breathing, the air inhaled through the nose and mouth enters the respiratory passages. Then, the air entering the respiratory system passes through the trachea, then splits into the bronchi, bronchioles, and finally enters tiny sacs called alveoli, where the exchange of gases takes place. Asthma is a disorder of obstruction to breathing due to inflammation and narrowing of the bronchial tubes. Initially, the bronchial tubes become inflamed and produce thick mucus. Later, the muscles surrounding these airways tighten and air cannot move freely. This is called bronchospasm. The result is shortness of breath, and the air moving through the tightened airways causes a whistling sound known as wheezing. Pollen, pet dander, weather changes, tobacco fumes.
Inhaled substances, such as chemicals in the workplace or cigarette smoke, can provoke an asthma attack without stimulating an allergic reaction. Over 200 substances have been associated with occupational asthma. Viral infections, emotional upset, stress, air pollution, or even reflux of stomach acid into the esophagus are known to elicit an asthma attack.
Condition, which
used to be so certain, and I can't figure out what is their subtraction. I only feel the pain, nothing left to reason, and only you to blame. Will it ever change? 'Cause I am barely breathing, and I can't find the air, don't know who I'm kidding.
Treatment of asthma involves avoiding the causative stimulus and drug therapy. Steroids and mast cell stabilizing agents, which prevent the release of chemical mediators from mast cells, are used to reduce airway inflammation. Theophylline and other drugs are commonly used to cause bronchiolar dilation. Although treatment is generally effective in controlling asthma, death by asphyxiation rarely occurs.
Bronchodilators are, by their very term, medications that dilate or relax or widen the airways. Bronchodilators come in many different forms and formulations. Bronchodilators come by injection, they come by syrup, they come by tablet, and the most commonly used in inhaled form. There are inhaled bronchodilators that are short-acting, and there are inhaled bronchodilators that are long-acting. The type of bronchodilator that you use and the formulation that you use should be tailored to your particular condition and should be appropriate for the type of problem that you had. That can be only achieved by discussing the medication with your doctor and using it as prescribed. Overusing bronchodilators, unfortunately, is a common reason why people end up in the emergency room in the hospital. So don't be one of those patients.
Please don't come and go. 'Cause I am barely breathing, and I can't find the air. Don't know who I'm kidding, imagining you care. And I could stand here waiting, a fool for another day. I don't suppose it's worth the price, it's worth the price that I would pay. Yeah, yeah, yeah. But I'm thinking it over anyway. I'm thinking it over anyway.
Corticosteroids work over an extended period of time to lessen the inflammation in the lungs.
Bronchodilators that we use are in a chemical classification called beta agonists. Beta agonists mean that these are medications that stimulate the beta receptors. The beta receptors are receptors that are found in many organs of the body. They are found in the lungs And these receptors cause dilation or opening of the airways. That's why when we use a beta agonist, we're stimulating the beta receptor in the lung, specifically in the bronchi, which are the airways, to open up. Beta receptors also are found in the heart and in the blood vessels. So as a result, very often one of the side effects of using a beta agonist is it stimulates the heart in terms of increasing the strength and the frequency of the heartbeat, and in some cases can actually increase the blood pressure. Leukotrienes are chemicals that cause bronchoconstriction, tightening of the airways. We used to refer to these chemicals as slow-reacting substance of anaphylaxis, but recently they've developed a new name called leukotrienes. If we could somehow block leukotrienes, then we might be able to relieve the bronchospasm, the tightening of asthma. So there are new medications called leukotriene modifiers. They occur in tablet form, chewable tablet form, and there are several different brands. The key with leukotriene modifiers is that in the majority of cases, these are add-on medications to patients who are already on inhaled corticosteroids.
Move on and break down. If everyone goes away, I will stay. We push and pull, and I fall down sometimes, and I'm not letting go. You hold the other line, 'cause there is a light in your eyes, in your eyes. Hold on and hold tight. If I'm out of your sight, and everything keeps moving on, moving on. Hold tight, make it through another night. And every day there comes a song with the dawn. We push and pull, and I fall down sometimes. I'm not letting go.
Anthony Shadid, a famous reporter, died on February 16, 2012 from a fatal asthma attack. He was a foreign correspondent for the New York Times based in Baghdad. He won the Pulitzer Prize twice. He died from an acute asthma attack while attempting to leave Syria on horseback. Shadid was a heavy smoker and also allergic to horses. His smoking and asthma both reportedly triggered his fatal attack. The death of Mr. Shadid, an American of Lebanese descent who had a wife and 2 children, abruptly ended one of the most storied careers in modern American journalism.
Breathe in and breathe out. 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 Look left, look right, to the moon in the night. Everything under the stars is in your arms.